evening. I'm Christy Casciano.
I'm Jeff Kulikowski. President Trump's enormous spending and tax cut plan back up for debate, this time in the House after the Senate passed it by the slimmest of margins.
The scramble in Washington largely revolving around President Trump's self-imposed July 4th deadline. In the bill, roughly $4 trillion in tax cuts, mostly for the wealthiest Americans. No taxes on tips and overtime, one of the president's key campaign promises, plus big cuts to Medicaid. And it could also take health coverage away from some nearly 12 million Americans over the next decade. According to Governor Kathy Hochul, the president's mega bill would have a devastating impact on state health care providers, patients, employees, and communities.
News Channel 9's Jeremy Skiba tells us what that means for local community health centers.
If President Trump's mega bill passes the House, the CEO of New York's Community Healthcare Association says the effect will be far-reaching.
This really impacts everybody because, as I said, community health centers are an essential source of care for everybody in their community. So they do have a lot of Medicaid patients, but they also have patients who are on Medicare or have private coverage.
She says it will be harder for patients to get care.
They have to reduce their hours, which means less access for patients. Many health centers are open in the evenings or on weekends, times when people who are working, to accommodate people who are working so that they can still be able to get to a doctor's visit. But they may have to reduce those hours. They may have to reduce staff.
Duhan says the bill would result in a loss of $300 million for health centers around the state, including the one here in Syracuse.
We anticipate that there would be a $17 million loss in revenue just for health centers. So that doesn't even include losses for other kinds of healthcare providers. In the city of Syracuse, we have one very large community health center that provides care to many of the city residents. And that health center specifically would really feel this impact.
She says community health centers serve a large number of Medicaid users, and things would change for them as well.
Under this bill, they meet the eligibility requirements, but the burden that will be placed on people, they'll have to prove that they're working. They'll have to recertify frequently in terms of their eligibility.
Changing the landscape of the healthcare industry with just one bill. In Syracuse, Jeremy Skiba, News Channel 9.